602-433-7000.
And a big thank you to Desert Financial Credit Union for sponsoring our KRIM Community Spotlight Program. Good morning, Payson. Happy Wednesday to everyone out there. Hope you're having a great day. Congratulations to the Payson High School boys soccer team on their victory last night, senior night, out there at Rumsey Park. So everyone that came out to support them, thanks for coming out, supporting the boys, and congratulations to them again on their senior night victory. Well, today in our office, in our studio here in Sawmill Theaters, we have Banner Payson Medical Center CEO Hoyt Skabelund. Good morning, Hoyt.
Good morning, Chris. Thanks for having us.
Oh, you are so welcome. And he brought along with him Dr. Daniel Porter, DO and Emergency Medicine, Banner Payson Medical Center Facility Medical Director and Vice Chief of Staff. So good morning, Dr. Porter.
Thanks for having us, Chris.
And I heard when Hoyt came in the door, he said, "Hey, you look pretty good for working all night." So you worked last night in the ER?
I did just pull an overnight shift. A little tired, forgive me, but we're doing all right.
No, hey, no, thank you so much for coming in.
Yeah, of course.
After working all night. This morning we're going to be talking about ER, the emergency room, and just the great strides, if I can say, that have been made in the emergency room, just all of the wonderful things that are happening in the Banner emergency room that people really need to hear about.
I think so. It's been said that emergency departments are the front door of the hospital.
Mm-hmm.
And patients don't necessarily choose to go to the emergency department. It's usually a disruption in their life. It's unexpected. And so it's really important to leave the best impression we can and provide the very best care and experience that we can. And with Dr. Porter and the nurses and the entire team that we have, we've achieved some of the best results I've ever been part of in my career. And we started 3 years ago. We were within Banner's 34 plus emergency departments. We were in the patient satisfaction side of the house. We were in the bottom 5. And so in 3 years, actually about in 2 years, we began being in the top 5. And then now for 4 or 6 months, we are number 1 in Banner. And not only number 1, there's no other hospital that's near the same scores that Dr. Porter and his team are achieving. So I was hoping Dr. Porter could tell us more about the secret sauce.
I wish it was as easy as just one secret sauce. It has been, I was visiting with one of our team managers this morning. What we want people to experience when they come into our emergency department is caring people, caring for people. Mm-hmm. We want them to feel that, hey, we are truly sorry you're having an emergency. We're going to do the very best that we can to take care of you and to make you feel comfortable and to trust that you're getting appropriate emergency care. And so we want people to feel trusting in our staff when they walk through our emergency department doors.
Mm-hmm. Again, and I think it was before the program, you were talking about being intentional about these things. It just doesn't happen. It just doesn't kind of like y'all come together as doctors, nurses, and staff in the ER or any other department in the hospital, and you come together and, okay, let's do this, and you get that superior quality care. It is intentional. I mean, it's something that you have to be focusing on constantly, working on constantly. So, and I'd imagine your team, the team of the doctors and nurses, they all have to be on board with this culture.
We've had buy-in from every single person in that department, from the registration people that help you up front, from our EBS staff that help us keep our rooms clean and our floors clean, to techs that help us with some of the other tasks in the emergency department, nurses, physicians, nurse practitioners, PAs, every single radiology techs, lab techs, every single person that interacts with the emergency department, they're bought in on the culture.
That is great.
I think that is the key. Is good processes and good approaches work only when you have good people. But good people without good processes and good approaches can fall short, despite having the best intentions. And some examples that maybe Dr. Porter can tell us about, but there's Dr. Porter and his team, they have metrics that they have intentionally chosen to measure that relate to best outcomes. And I don't know if you want to choose your favorites or.
Yeah. Not necessarily chosen by us, but something that's mandated by the federal government that we track and that we publish so that the public is aware of this information. One thing that we track very closely is what we call our sepsis numbers. Sepsis or somebody being septic, what that indicates is a severe bacterial infection. You can get very, very sick, sometimes even fatal infections. Our goal in the emergency department is to identify people that are septic or that have indicators that they may be becoming septic and to initiate treatment early. There's data that shows that when we treat it early, when we identify and treat early, your long-term outcomes are better. Shorter hospitalizations, your mortality rate is much lower. That's one thing that we've been focusing on in the emergency department, specifically this year. And there's a whole bundle of things that we have to perform in the emergency department within 3 hours of them checking into the emergency department. Not 3 hours from the time that they're bedded, 3 hours from the time that they see a physician, 3 hours from check-in. And it's a whole bundle of things, labs, antibiotics, fluids. And really this year we are performing amazingly. I mean, for our facility goal, we're 10 points above our facility goal. And these are...
They're challenging set targets. So to be 10 points above this target is spectacular work. I think what's fun is in the department, Chris Creevy's one of our seasoned nurses. She's amazing.
Oh, yeah,
You know Chris?
I know Chris.
She
Yeah,
is the
great.
sepsis queen. Is that the right title?
She's the sepsis queen, yeah.
And she's created awards for providers and staff, and if you ask about sepsis in the department, every employee is aware, and it makes it fun.
Wow. And she makes incredible banana bread.
Does she really?
Oh my gosh.
Isn't it her husband that?
Andy, the hot dog guy.
The hot dog
yeah,
guy.
Hot dog man, Andy, yeah. We did many concerts in the park together when we had Scoops
Okay.
and ice
Yeah,
cream.
ice
And
cream.
yeah, they're a great couple. She would always come in, during the concert because she was working. So she was at the hospital, and then she would come and, help Andy out. But yeah, makes great banana bread.
Does she really?
Oh,
Well, maybe we
gosh.
should add banana bread to the septic
award.
bundle,
Yeah.
or maybe to the sepsis awards.
Yeah.
A slice of
Yeah.
her banana bread.
Maybe that can help with sepsis. I don't know. So, are there any, and just hearing stories of people that have had sepsis or have been septic,
Septic.
yeah. Is it more common in like certain age group, or are there different, I don't know, like people that are more susceptible, or can it be like anyone?
So really anyone, even all the way down to our pediatric or newborn
Really?
patients.
Okay.
There are certain things that make you at more of a risk of
Okay.
developing serious bacterial infections, particularly some of our geriatric population. Certain underlying health conditions, diabetes, if you're immunocompromised, if you've been receiving chemotherapy, or if you're on immunosuppressive medications. So there are some things, but it can affect anybody from day 1 to year 99.
Wow. And that's great. I love Chris with, Chris just,
Motivating.
being, I guess, so in tune, or just, sounds like something that, is real, I don't know if it's personal for her, but that she just, gravitated
Passionate.
towards that, passionate about
Passionate.
it. Yeah, passionate about that. And it's great to have, people like that in ER.
25 years ago when I started the career, I remember sitting at the medical staff meetings, and sepsis, we didn't have the advanced bundles. We didn't have the data yet. And some doctors were arguing, I can't anticipate this, I can't diagnose this. But now with the help of electronic health systems, with reminders and with data analysis, Dr. Porter, but then the human aspect. Positive reinforcement is one of the best ways to learn and retain quickly and change habit. And if you've been a nurse for 20 years, to build in, we have to be changing all the time. And so to have someone celebrate and make fun ways to reinforce until it becomes our new way, you know, and so now we're achieving the best sepsis results I've ever seen in my career.
And what other processes or, you know, programs,
Techniques,
techniques
approaches.
been implemented in ER?
Well, like we were mentioning our patient satisfaction, one of the things that we are very proud of, patient satisfaction. You know, all of this that starts in the emergency department flows over to our inpatient side. We want our patients to feel comfortable with the care that they're getting, and we want that to flow over to the inpatient side to when we pass them off to the hospitalist, saying, hey, this is Dr. Rooney, this is Dr. Edemont, I trust them, they're going to take great care of you, and kind of rebuilding some of the trust in the community with the facility and with the work that we're doing at Banner Payson.
Some of the techniques that as a non-clinician, when I'm a guest to the ED to go see them and visit the team, rarely, now there's going to be listeners out there that say, well, wait a minute, that wasn't my experience, because there are days when we always knock on wood, don't ever go to the emergency department and say, oh, you guys are really slow. Everyone will give you the stare of death, because you're about to just cause all of the mayhem to break loose.
It's the same with public safety. You don't do that in the police department.
Exactly.
No.
So when you go down there, we try what's called immediate bedding, which means we want to have, as soon after as your arrival and you're greeted at registration, to take your name, be able to get you where we're getting a wristband so we know we got the right patient. We want to get you into one of our beds, or in some cases, if it's a walking ambulatory patient that doesn't need a bed, they might be a shorter stay. We have recliners. So it's called immediate bedding. So we don't want our waiting rooms to be full of patients waiting. We want them to be empty or full of visitors who are waiting for their chance to go visit their family. But that's always impressed me. And then there's a joint discharge, or you and the nurses try to work together?
Yeah, so what we want people to understand, or patients to understand, is what next. Okay, you were seen in the emergency department, this was your diagnosis, now what? So one of the things that we've been working on is a joint discharge, where we go in with the nursing staff and their discharge paperwork and go over, this is some information about your diagnosis today, these are some medications that were sent to your pharmacy, this is who I want you to follow up with. Of course, if anything changes, if things get worse, this is what you need to be watching for to come right back to the emergency department. We want them to understand, hey, this was just a little brief snapshot in what's going on in your health. This is what we think is going on. This is how we need to take care of it next.
And I love what you said about the nurse and doctor being in the room together, because during that visit, rarely will the nurse and physician be able to be in the same, at the same time, side by side with you. Unless you're very, very ill, then you're going to have a lot of folks next to you. But the closure, now you're hearing a united message, and the patient might say, well, what about this, nurse, you had mentioned this. The doctor gets to confirm it. It's very reassuring. Having been a patient in an ER, and my wife having been a patient in an ER, there's something about that joint discharge that leaves you feeling closed, good closure, and it's a great technique. Another one that I've mentioned that we use, that our medical staff use, which I'm very proud of, it's so simple, but it's uncommon. And that is that if the physician can be at your eye level as a patient, you feel a connection, you feel an engagement. It's psychological, it's just about it's about human distance. So our doctors try to take a stool or chair. Dr. Porter actually wears out the right knee of his scrubs. If you go into our ER, it's fascinating. Often I will see him kneeling on his right knee at the bedside talking with a patient. It's powerful. And it may not be noticed by people consciously. Subconsciously, it's an extra mile to say we are good people trying to care for good people and provide good care. And then our hospitalists often have longer discussions because the patient is staying overnight. We have stools that are available for them to sit down. It reassures the patient they have time. Where if I'm standing, you may feel like, well, I don't want to bother them with more questions.
Yeah, like they have to go. They have to go to the next patient. They have to, leave where, when they're sitting, kneeling, it does, I think, send a message that they're taking the time. They want to take the time to talk with you, to answer the questions.
In 25 plus years of leading hospitals, I've never seen a single physician get more accolades
Mhm.
unsolicited than Dr. Porter. I think that's a key part, is having leaders who try to lead genuinely by example, not do what I say, not what I do. That's not Dr. Porter. He's do what I do. And so I think get the right people want to be part of excellence. And so our nurse retention is some of the lowest I've seen in my career, even after the pandemic. Our recruiting, we're really, knock on wood.
Highest retention, lowest turnover. There it is.
There you go, yeah.
People want to
Wow.
stay with us, and now we're always fine tuning and polishing.
Mhm.
We're human beings, and I'm so disappointed. I'm going to be 54 here later this week, and I feel like as adults, I always thought it would be some miraculous change. It feels like high school still. You know what I mean? It's like high school on steroids. People have more money, and egos get bigger, and so you're never arrived. We're dealing with adults that are at different stages of life and different personalities and styles, and so it's always going to be a sanding, a polishing, a buffing. But I think we're with the right people. Now we just need to make sure we're listening to them and keep them. It's super fun. You can tell I'm way excited about what we're achieving right now for our
Yeah.
patients.
I think that's human nature. It doesn't change from
No.
elementary, high school, into adulthood. It's,
I was reading in the paper the Longhorn Hall of Fame nominations and awards.
Mhm.
I read the paper, was it yesterday, that Eric Anderson was highlighted.
Mhm.
And I know Eric, but I didn't know all that was said. But he was voted homecoming king. I thought it said it. He was known for being everyone's friend. So the one thing the reason I bring this up is, being kind to all, being a friend to all. I'm grateful that in things that not changing, I'm grateful that one thing hasn't changed, and that is a few people can make a big disproportionate difference. Each of us can make a difference in our sphere of influence. We could do that in high school, and we can do it now as adults, and I hope that's America. And so Dr. Porter's an example of making a difference in his sphere of influence, and you as mayor, you could be home having a much calmer life. And you've chosen to be, and that goes to everyone, even of different parties and different philosophies. Those who want to serve publicly, hats off for choosing to make a difference.
With local businesses and 8 children, my wife and I, we've never had a quiet life.
Okay. All right, a simpler life than you've chosen now. Let me just say it that way.
It's funny, when people talk about that. Oh, quiet or this or that. Are you ever bored? It's like, oh no. And I tell them that, and they're like, wait, what? Again, if you're just joining us, talking with Banner Payson Medical Center CEO Hoyt Skabelund and Dr. Daniel Porter, the facility medical director and vice chief of staff, also head of the emergency department. I know ED is what you actually referred to.
Yeah, it used to be. I used to be called ER, and then they said we're more than a room.
We're a whole
we're not a
department,
room.
not just a room.
Yeah.
But ER on TV, and so we
Yeah.
understand what you're referencing. But
Yeah.
in our profession, we always refer to it as the ED or the emergency department.
So I just have to ask, because looking at information that was sent to me for the program, ASU graduate, and is there a little rub there with the U of A medical?
I try to keep it civil. But we do have students in our emergency department and in our hospital from the U of A.
Yeah.
I treat them all the same.
No, it's fun. Another big aspect, and I don't know if they're still involved with the emergency room, but volunteers. Ken, I believe Ken is the volunteer in the emergency room. I don't know if there's others, but I know previous or past programs we've had, and we've talked to volunteers, and they have a big impact on all the departments and with Banner. So that is true, isn't it?
Yeah, we briefly lost them for a period of time because of COVID and some of the certain restrictions that we were dealing with. Tremendous loss. Having them back in the emergency department is awesome. Ken is one of my favorites.
Yeah.
It just seeing them walk around to the different rooms and interact with the patients.
You need a
seeing them
blanket, are
drink
you
a cup
cold?
of water or a fresh cup of coffee. It's so good just for the environment as a whole in the emergency department.
They're wonderful, and they also, we have some patient liaison volunteers who interview patients to learn how's your stay going, what are you, is there anything you're disappointed with, etc. And that feedback is real time and helpful to us, and it's hard to staff adequately to be able to round on every patient as thoroughly, and the volunteers are such a tremendous asset to the care that we provide at the hospital.
And that's probably not something you see at every hospital, is it? I mean, in the Valley, Banner Desert, I know I was
Too
in there.
too large to be able to.
Oh my goodness, it was like a circus in there. It's crazy.
We are so thankful for Banner Desert, Banner University. We send 80% of our transfers that Dr. Porter orders go to Banner Desert.
You know, being in a rural facility like Banner Payson, we're met with certain challenges that you don't have at some of these bigger facilities, which at times can be very frustrating, both for physicians and nurses, as well as for families and patients. One of the big frustrations that we've had is Hoyt had mentioned that we transfer a fair amount of patients, about 8 to 10% of the patients that we see in the emergency department end up needing a higher level of care than we can offer at Banner Payson.
Yeah.
So our objective is to get them to the most appropriate level of care, usually means down to the Valley. We have seen, because of certain staffing issues in the Valley, because of bed availability, some of these patients stay in our emergency department for 24, 36 hours
Oh, wow.
before we can get them down to the Valley.
That's new after the pandemic, or during the pandemic and after,
It is.
really related to, like you said, to staffing. I don't recall in my career a handful of patients staying more than 24 hours in an ER. Now, across the nation, it's become the new way. And so that's hard. And so if we know a patient's going to stay because of bed availability for more than 24 hours, we try to get them into a more comfortable bed in that small space. But we try to accommodate. Sometimes we don't know that it will be that long, and so we do our very best. But that right now is, if there's an Achilles heel that we have that we can't control, it's delayed transfers, and it's occurring in the Valley, transferring to larger hospitals. It's not just a rural, but it's a sad part of medicine. That has to do with the nursing shortage that's come about.
It's often not a matter of capacity. They have the beds. They have wings of the hospital that they've had to shut down because they don't have the capability to staff those beds.
Probably one of the scarier realizations about national healthcare is that how fragile it can be by people choosing the career, choosing to be nurses, and the industry has given substantial pay increases. We've probably across Banner, our average has been about 20% in the last. That's a sizable increases, and then you have the inflation on top of that. One hospital per month this year has closed across the country. Never seen anything like it.
One hospital
One per month. The more recent report I read, 50 hospitals are in danger of closing or shutting down major service lines. And so we're grateful we're not in that predicament.
But that ultimately is putting more pressure on the neighboring and existing hospitals.
In Arizona, I'm not aware of a hospital closing, thankfully. In these higher populated states where every 15 minutes there's a town, and that's where you're seeing there's too many hospitals. When I say that, it's never enough, but that there's too many to be supported by the workforce and the expenses, etc. So there's economies of scale if you can consolidate. So we're not within 90 minutes of another hospital. That's helpful. So that is a protective factor for us. And then we just need to deliver excellent care so people will choose to receive services local that are appropriate. And then we'll direct them when we can. And then you have optimal volume. So harder to do than it sounds. We're trying to always identify new services that we could sustain, financially are sustainable, that help meet community need. And that's what we're working on. But most patients have heard of a patient that has an ER experience, and we're hoping that those that were more than 3 years ago, that they won't fear coming to receive care from us Our clinical quality is outstanding. Dr. Porter is the elected vice chief of staff on the medical staff. That his respect by his peers, colleagues, we're so lucky to have him and his team. Great physician, nurse practitioner, PA team. Nurses are great as well. Now, one change that we're working on is we have had curtained exam rooms without glass doors. And that makes it hard to control noise and keep it quiet for patients when they're waiting. And so we applied for a grant, received funding, and we've been waiting. It feels like the most eternal process, but we've got the head walls built that will hold those breakaway glass doors. So in the coming months, patients will notice a difference, that there's quieter exam rooms. The curtains will still be there for privacy, but there'll be quieter exam rooms. So we're trying to improve. And despite having those physical constraints, we have the best, highest patient satisfaction of any emergency department within Banner Health, which is one of the nation's top health organizations. So we're pretty proud of it.
Yeah, also reading, and that's right, I remember you came to Payson via Kingman.
I did, yeah.
Yeah, and actually one of our daughters was in Kingman, and this last couple of years she was working at Kingman Regional Medical Center.
Yeah, that's where I did my residency.
Yeah, so Kingman versus Payson.
Yeah.
I mean, what do you enjoy, I guess, more about Payson, or what has been a better experience?
So here's what, I'm a Valley boy.
Okay.
I grew up in Mesa, that's where I was born and raised, went to ASU, and then did med school in the Valley.
And what high school?
Mountain View High School,
Mountain View.
Toros.
Oh, my wife's a jackrabbit.
There you go. This is there. You can't be tough if you're going like this. It's a Toro.
Did you see the painting of their jackrabbit on the school? He's jacked.
Is he
A
jacked?
jackrabbit with like traps.
Big trap.
Yeah.
Here's what I enjoy about Kingman. I got a little taste for rural medicine.
Okay.
I've practiced since leaving residency. I practiced a little bit at Banner Desert, at Banner Baywood, some of the bigger facilities in the valley. You don't get the personal feel that you get here at Banner Payson. No, you don't get the time to sit down, to kneel down next to the patient and say, look, this is what's going on. I'm sorry that this is happening. It's a numbers game. You're forced to get in, see the patient, get them out, or get them upstairs, get them where they need to go. Here, we make connections with people. I can't tell you how many times I've seen people out and about say, hey, I wanted to let you know this is what's going on with grandma, or hey, my little boy's doing awesome, this is what happened. You saw my neighbor, this is what happened. You don't get that at a lot of facilities. So to have that community, that family feel, irreplaceable.
And that's true with all of the staff, with the nurses, with all the
Guest,
specialists.
hopefully hopefully we can help you feel like a guest in our home. And that, if you're going to live rural, I don't believe living rurally. I'm passionate about this. I grew up rural. Is a disadvantage.
Yeah.
We have so many advantages. There are some inconveniences, but if you embrace the things that are good in healthcare, what Dr. Porter just eloquently described is an advantage to receiving care. And we're not going to keep you here if we can't provide you the best clinical safety. So you can trust us. We're going to transfer you when you need to be transferred. Don't drive yourself to the valley. We come here, have Dr. Porter evaluate you, and verify whether you need to go. And if you do, we want to top you off, top your fluids off, etc. We want you to be safely transferred. But we're very proud of it.
We will never send you to the valley if we don't think you need to go there. The only reason that you're being transferred is because we have recognized that there's something going on, there's a medical condition. You need something that we can't offer here at Banner Payson. Let's get you where you need to be so you can have the best care possible.
Amen.
There you go. Well, it's 10:30. It's that time, and it was great talking with you this morning, Dr. Porter, Hoyt, always. Thank you for coming in each month and sharing with our listeners and viewers about what's happening at Banner Payson Medical Center.
Our pleasure and an honor. Thank you for having us.
No, thank you so much. Well, time to get back to the music now here on KRIM, but before that, we're going to get a quick update from the National Weather Service. You guys have a wonderful, blessed rest of your day. Darn, why did that password work?
With this morning KRIM weather forecast.
Good night.
All right.
You wrote